Good evening, everyone, and welcome. I'm Monica Harris, Executive Director of FAIR, and I'm thrilled that you've joined us tonight for what I think will be a genuinely eye-opening conversation. At FAIR, we've spent considerable time examining how ideological frameworks in education can shape and sometimes distort how we understand ourselves and the world. But we've also become increasingly concerned about how ideology can constrain scientific inquiry itself, particularly in medicine and mental health. Through our Fair in Medicine initiative, we're dedicated to supporting the scientific method, viewpoint diversity, and rigorous inquiry, and in the search of objective truth. We believe that intolerance is the enemy of free and open inquiry and respectful scientific debate. Just as we've seen crucial discussions around gender affirming care for minors, we've seen it suppressed and distorted by ideological pressure. We're also seeing similar dynamics around mental health treatment, where certain approaches are elevated while others are marginalized, often not because of the evidence itself, but because they don't fit the prevailing orthodoxy or medical paradigm. So tonight's conversation addresses this issue directly. I'm delighted to introduce Dr. Kendra Kautz, a chiropractor and holistic health consultant based in Orange County, California, who recently wrote a compelling essay for Fair Substack titled The Body-Mind Connection: How Physiology Shapes Mental Health. Her work represents precisely the kind of rigorous evidence-based inquiry that often struggles for recognition in a medical establishment that has become increasingly siloed and, frankly, ideologically constrained. Dr. Kautz approaches health from a whole body perspective, combining chiropractic care with applied kinesiology to evaluate how structural, chemical, and emotional systems interact. After experiencing her own struggles with burnout and gut issues and migraines and autoimmunity, she's become passionate about helping others understand what might be holding them back from optimal health. So, what I find particularly relevant to FAIR's mission is not just the scientific validity of her approach, but the fact that these physiological explanations for mental health struggles are often overlooked or dismissed in favor of purely psychological or pharmaceutical interventions, or worse, ideological interpretations. So the question we need to ask ourselves is why? Why is this happening? Why has a medical establishment become so resistant to investigating the root causes of our illnesses? Why is there such reluctance to consider that what we're medicating might actually be malnutrition, inflammation, or nervous system deregulation? So, Dr. Kautz, thank you so much for being here tonight and for your willingness to discuss these issues openly.
Absolutely. Thanks.
So, I, Dr. Kautz, I'd like to start with a foundational question. The fundamental premise of your essay, and frankly, what I feel is a tremendous gap in mainstream medical discourse. You write about the body-mind connection in a way that challenges the dominant paradigm in mental health treatment. In your experience, why has the medical establishment been so resistant to investigating the physiological root causes for mental health symptoms? Is this simply professional specialization, or is there something else at play here?
Yeah. So like obviously I'm a chiropractor, right? I have not gone through MD training. I'm not, I mean, I have friends in that field. We openly talk about like how much nutrition was involved with their training versus mine. Neither one of us get that much training within that. And obviously, there's a lot of physiology involved, but primarily, it's like they're very good at understanding how medications affect, well, what they're trying to affect on a blood marker, not so much like downstream effects
Mhm.
of like where that would deplete you nutritionally, but also I don't know. I think it's just, it's the memorization there, and then knowing, okay, well, this drug can't interact with that one, which is very, very important because if a drug negatively interacts, that obviously can kill someone. There's
Mhm.
there's high risk
Right.
there. So I think that's where a lot of the focus goes to because there is so much risk in a lot of these medications that are given.
Liability. Yeah. Yeah.
Yeah,
Yeah.
yeah. But I don't think it's like for lack of caring. I think everyone goes into these fields to help people. Um, and even in my field of work, we're more holistic, which is why I decided to become a chiropractor. I actually had chiropractors telling me to become like a naturopath. They're like, it's just more
Mm.
respected, and now I'm seeing that
Oh,
in this
really?
line of
Okay.
work. Oh yeah. Um, but I'm so glad that I decided to become a chiropractor because of how what we do affects like the neural inputs and then outputs of the body and affecting everything. So anyways, to answer your question, I don't think it's like I don't think there's any malice intent behind anything. I think
Hmm.
everyone went into it wanting to help people. It's just, okay, did you take extra courses outside to get this extra information? I was in a webinar or a seminar almost every weekend while I was in school to get student discount rates
Hmm.
and to learn as much as I could. Because I knew, even though once again I wasn't taught this in chiropractic school, I knew how much nutrition and hormone health played a role in structural health.
Hmm.
So that's what made me dive into that while I was in school so I could make those connections as I'm treating patients. So I'm not just looking at someone from a chiropractic structural standpoint, which is super impactful. But
Hmm.
I just knew that there was more affecting the structure in the health of someone. So once again, to answer your question, I don't think it's anyone trying to give poor care. It's just, did you make those connections enough to know you need to go learn more and then connect the
Hmm.
dots?
Yeah, it sounds like clinicians have to take on quite a bit of initiative in order to, yeah.
Yes.
And
Yeah.
I've noticed, speaking as a patient, with friends and family members who've had cancer, and doing their research and my own research to support them, my eyes have been open to the importance of nutrition
Mhm.
in treating cancer. And one of the things I learned was that sugar is like cancer's best friend. And to keep cancer at bay, you have to have an alkaline body. And when I think my partner's mother was battling with cancer, she mentioned to the doctor, "Well, should she cut back on sugar?" And he's like, "No, she can eat whatever she wants." And my partner was like, "Wait a minute, that doesn't make any sense. There's aren't there any nutritional limitations or anything she should be paying attention to?" So it does seem like this is pretty widespread, this belief that nutrition doesn't matter
Yeah.
when, treating symptoms.
Right.
Um,
Or it's just for some reason, maybe I think it's where, especially with mental health, it's the liability. If someone comes in and says, I feel like I want to end my life, then
mhm,
the protocol, would be we need to give them something, right?
mhm,
Versus, hey, I think you should go see our dietitian, you know?
mhm,
Whereas I
mhm,
think the protocol should be, okay, great, give someone something that could possibly either have a placebo effect and help them in that sense, because they don't all work that fast, right? Some of these medications but then also make that dietitian or functional medicine referral so that it's
mhm, mhm.
being, uh, approached from all angles. And then maybe even a chiropractic referral or an acupuncture referral or, you know,
Right.
yeah.
All right. So let me ask you, how does applied kinesiology help you identify these deeper physical root causes that conventional diagnostics might miss?
Yeah. Like I said, when I was in chiropractic school, we didn't actually learn applied kinesiology. This was something I had to learn outside of it. There are a ton of different tools or um, types of chiropractic practice
Mhm.
that you can learn. We
I'm
all learn
sorry.
how
You know
to,
what? I'm sorry. Can I interrupt you?
yeah.
I jumped into this. Maybe you should explain for our viewers what kinesiology is for those who haven't read your Substack piece.
Yeah, yes, I will do that because
Okay.
kinesiology is just the study of movement. So it's
Mhm,
it's different because even when when I say applied kinesiology, people are like, I know what that is, and it's not the same.
Mhm.
So think of it
Mhm.
like I think a lot of people have heard now of, especially if they've gotten body work done, something called like ART, active release technique.
Mhm.
It's like
Yeah.
very big with athletes, or cranial sacral technique, or neuro emotional technique. These are all techniques and tools. So that's where like applied kinesiology comes in. It was another technique and tool developed
Mhm.
by a chiropractor to help, assess and then treat. So yeah, kinesiology is just the study of movement, and applied kinesiology is looking at someone structurally as we naturally do. We're taught to assess for nerve function, range of motion, um, like ruling out like more serious things to then refer out. Like that's what we were taught as chiropractors. And then how do we adjust that segment?
Mhm.
And we know by adjusting a segment that we have impact on, nervous system benefit, actually, depending on how you adjusted the person. Sometimes it can go negatively. Um, or organ function, because every nerve in the spine controls an organ and a
Mhm.
muscle, right? So, and I'm saying this because this is where applied kinesiology, it's like the same line of thinking. So with
Mhm.
that, so structurally, then chemically, okay, or hormonally, so that's like where the nutrition piece comes in, or you're looking at someone emotionally. So it's the three pillars, and that's what applied
Mhm.
kinesiology is about. And I got introduced to it because while I was in chiropractic school, I had a shoulder injury, and I'm sharing this because I'm sure someone can relate to this, that it was from a car accident. So that is a very physical, uh, like injury, right? It's like, well,
Mhm.
yes, my shoulder hurts from this. So, and it went out, my SC joint came out of alignment from the impact, but I had everyone telling me from all the muscle, labral tests, whatever, that I had a torn labrum.
Mhm.
The entire time it was an incorrect diagnosis for 5 years. And then
Mhm.
I had one friend in my program, she's like, you really need to go see this guy who practices applied kinesiology. And he was able to fix it very quickly just by his assessment skills and muscle testing, which is they teach a little bit different muscle testing techniques than you learn in chiropractic school. But it's still all assessing nerve function. And then within that session, he was like, has anyone ever told you your thyroid might be having a problem? And I'm like, no. And I didn't know what he was talking about. He's just looking at me. And now I know like the symptoms and what he saw in me that made him just say that. Um,
Mhm.
so anyway, so that's how I got introduced to it. And then like through my own, and I had knee surgeries, 4 knee surgeries. I was, uh, like, you read in my bio, I had all these issues
Mhm.
that were basically not allowing me to heal well, despite doing so much physical therapy and being very like disciplined.
Mhm.
And then I was introduced to the idea that, oh, your hormones are so off, right? Like my thyroid being off, adrenal system being off. And that is inhibiting me from healing. It's inhibiting me from having proper muscle function. That's so I'll give an example real quick before going off too
Mhm.
far. Again,
Mhm.
this is so common, and this is why I want to share this one. So, like, as chiropractors, we treat low back pain quite often, right?
Right.
And a lot of people have pain in their, or tightness in their hip flexors, like their psoas. Okay. So, based on where that muscle connects in the spine and into the hip, when it shortens, it pulls your back into more of a lordosis and you cause pain, right?
Mhm.
And so with that muscle imbalance, it can also throw the hips off. And I think a lot of people that go to a chiropractor, they're used to having their hips being misaligned.
Mhm.
So then you ask yourself in applied kinesiology, what nerve root is controlled by the psoas? Oh, great. It's like L1 to L3 because not everyone's the same, right? There's some discrepancy there. We're not all built the same, but it's around that. Okay, great. What organ does that nerve root control? Kidneys and adrenal glands. And we know the adrenal glands are a big part of our stress response in our
Oh
body.
yeah. Mhm.
So that often is a lot of times why people have low back pain. And then, people they throw their back out like when they had an emotional event in their life, and it's
Huh.
that imbalance and that circuit like misfiring, right? If there's inflammation at that nerve root, it'll affect the muscle function too. So that's a big part of applied kinesiology. Does
Huh.
that?
So the emotions, the stress, so that there's an emotional connection to the response to your back, the response your body might have in your back. Okay, that's interesting.
Yeah,
Huh. Okay.
because of what that does to your body hormonally, right? So if there is a stress response, like an
Hmm.
emotional stress response, causes you to
Hmm.
secrete more cortisol. And then if you're constantly having to do that, it's like an overworked organ essentially. And then there's inflammation at that
Ah.
nerve root, and it can impact the efferent flow to the muscle and cause it to
And
misfire.
if the treat, okay. And if you went to a doctor, I mean, if most of us went to the doctor with concerns about back pain, one
Yeah.
of the first questions wouldn't be, so what's going on in your life now? Are you stressed? How are you doing emotionally? There might be an X-ray and then followed by what's the medication or I'm just how do you think it usually plays out? Is that the way it would play
That's
out?
exactly how it plays out. And even the other, which I'll connect later, or no, I'll just do it now. So, you're saying what's going on emotionally. It's like, yeah, but also how much stress are you putting your body under? It doesn't always have to be emotional stress, right? So,
Mhm.
like, are you overtraining? Are
Mhm.
you wrecking your body nutritionally? Are you not giving it enough nutrients to support the amount
Uh,
of hormones that need to be produced? Um, and we'll talk about that more. But
uh-huh.
so no, the typical protocol is I have back pain. Okay. Um, Actually, a lot of times it's more, do you want an injection? Like, do you want
Yeah, right.
pain? Yeah, that's typically, which can be helpful. And I'm not, once
Mhm.
again, like I am never trying to shame what is happening, right? Like if that can get someone out of pain, but other things need to be addressed. Like it can't just
Mhm.
like the root is never being addressed if you're constantly just dampening the signal, which is the
For
symptom of
sure.
pain. Yeah.
Okay, well let's circle back to something else you mentioned earlier, which is the nervous system. And my
Yeah.
understanding is your approach includes chiropractic care that addresses nervous system function, which again, my understanding is that that challenges the psychiatric establishment's focus on brain chemistry, not the nerves, but the brain.
Mhm.
So can you just explain to our viewers the connection between spinal misalignment and mental health and why this structural component is so often dismissed in mainstream medicine?
Yeah. Um, so let me see how I want to answer that. Okay, so you know how I just was saying, like, here, let me use this, even like a pain example. So a real structural pain example. So our body is constantly sending sensory information into our brainstem, and then a signal gets pushed out for how does the body need to respond to this
Mhm.
sensory information. Okay, so if we have structural damage that is causing us real pain, then that also will affect output
Mhm.
for anything and everything. And it will also cause us to secrete more of that stress hormone, cortisol. It puts your body under a stress response. So there's like two basic ways your body can function. It's either, I think most of us have heard this, you're either in the fight or flight state, which
Right.
is like the stress state, which can happen from pain, constantly being in pain, or you're in the rest and repair state. So this is
Mhm.
the sympathetic nervous system, this is your parasympathetic nervous system.
Mhm.
So when we're stuck, let's say it is from chronic pain, or we're using the back pain example, someone, I don't know, fell at their job, had a real injury, and now they're in like so much pain, debilitating pain. Their body is in a fight or flight state. Cortisol
Mhm.
is a hormone that's actually a good response. It can have like a pro-inflammatory effect and help um, like basically get your body ready to fight essentially because you're in pain. Okay.
Mhm.
So, but when it's for too long, it can have these bad effects of nutrient depletion
Mhm.
because we require a lot of vitamin C to produce that hormone.
Mhm.
Uh, B vitamins, omega 3s get involved, and magnesium, and that will like then further deplete um, the system.
Mhm.
I feel like I actually like lost your question. Can you,
No, no,
and
I
within my
did. No,
response? Yeah.
I was just looking for the interaction.
Yeah.
The interaction between the nervous system and a lot of
Oh, and why is
these
that
symptoms and
commonly
illnesses.
overlooked? Right. And
Yes,
why is
but
that
yeah,
overlooked? Okay.
but right. My question is like, why do you think this connection is dismissed?
I wish I knew. I don't know why. Because it's
Mhm.
pretty, like, this is pretty, like, basic, and we all get this in our physiology lesson of how this works. And
Mhm.
that's honestly been my question over and over. And I think I have a tendency, even though I can get complicated with explanations, then I
Yeah.
oversimplify the solution in a sense. But it's
Mhm.
when, like, if a body is stressed, and like I said, leaning more towards the sympathetic state, I just gave those examples, you get depleted nutritionally, right? And then there's
Right.
more nutrients on top of that if it's prolonged,
Mhm.
calcium, iron, selenium, so these things matter for proper hormone production, for us to feel good, for
Mhm.
proper neurotransmitter production, for proper ovulation. Like for it's
Mm.
really like I think most health issues stem from this nervous system dysregulation. And it doesn't always have to be from a pain point. Like, I gave that example. If someone
Mhm.
really is in a lot of pain, that can throw your system into a sympathetic dominant state. A lot of mental stress can do it. Um, a
Mhm.
lot of abuse of stimulants can do it,
Mhm.
like caffeine. And I know people do not like me when I start talking about caffeine because it's their, you
Well, I
know,
can't live without my coffee. Yeah.
I know. And so this is the thing. It's not that caffeine's bad for everyone, but if you're in an already depleted state, whether
Hmm.
that's from, once again, like overtraining. So, you think exercise is amazing for you. It is amazing for you. If you take that to too much extent without knowing to properly supplement with those nutrients I just explained or support your system, right? Or if you're
Hmm.
overtraining and you have high mental stress on top of it, then your system's getting depleted and it can turn into a bad thing for your system. And then you get
Mm.
anxiety, you get depression, you get all these things that we're discussing.
So, okay, now you've touched on, I think, the heart of what we want to get into, which is hormones, and hormonal imbalances. And you write about that in your essay, cortisol dysregulation and
Mm.
thyroid issues and sex hormone imbalances, and how all of these can present with psychiatric symptoms, which is kind of frightening. So, my question is, how often are these missed in conventional mental health assessments, and what is the consequence of treating hormonal imbalances with psychiatric medications, which I think might be happening a lot, but you can tell me.
I think it's happening a lot too. Okay, so I think this is where I may want to pull up some slides
Oh,
now
you're
because
going to
they said
present
I had
something.
some
Yes.
slides.
Okay. For sure.
I think it'll be helpful. So,
Yeah.
how do I do that? Oh,
Oh, are you able to
wait,
share
share. Yeah,
your
sorry.
screen?
I'm not the most tech
Let's see if you
savvy.
can share. You might
Um,
get a request.
uh, did I just do desktop? Yeah.
You should have permission to share. Let's see.
Oh, wait, I think I had to click something on. Password there. Later. Let me try again. Oh, I think it'll work now.
Okay.
Okay.
Oh, very
See
good.
my screen.
Ah,
Okay.
yes, we see it.
Okay, let me make this bigger. And how do I get a presentation mode?
On the top right, there should be the present button. Right
Oh, thank
there.
you
Yeah, okay,
so
no worries.
much. Uh,
Ah, perfect.
allow. Sure. Okay. All right. So I find this chart to be so helpful. And okay, so you asked why do I think it's not great to give people medications when it could actually be like a hormone issue. Yeah.
Yeah, the consequence of treating hormonal imbalances with psychiatric meds.
Yeah. So I think to better understand that, it's, oh my God, how do I move this up here? Ah, there you go. Okay. So let's look at this hormone chart. And remember how I was
Mhm.
just talking about how when our body's under stress, we actually utilize more nutrients in order to um, basically convert certain hormones to then other hormones. So I wanted to show this pathway, and then I'll relate that to the neurotransmitters and how that affects the medications. So
Okay.
every hormone is produced, like this is the hormone pathway. So hormones start with cholesterol, which is why like a lot of times if I don't know, a girl doesn't get her period, a doctor will tell her,
Mm-hmm.
"Well, just eat more or eat more fat." That's
Mm-hmm.
typically the
Mm-hmm.
response. If that doesn't work, then they're missing this relationship that I'm about to talk about. And I see this all the time, which is why I want to highlight it.
Okay.
So, cholesterol, do I have a marker that's visible? Yeah, okay. So, cholesterol, and then it goes, basically, this happens in cells all around the body. It's not just happening in one place. We don't just have like a pool of cholesterol hanging out. This happens within cells.
Okay.
So pregnenolone is the second synthesized hormone when our body is under stress. And once again, stress is either physical or demanding. Like if you're overtraining, it could be
Mm-hmm.
emotional. It affects the body in the same way. I just want to hammer that home.
Mm-hmm.
So
Okay.
pregnenolone here in stress will then just get directly shunted to make more cortisol because really when our system is perceiving stress or it's under stress, we need cortisol to survive. So then we're
But it
stuck in
goes
that.
to progesterone. I'm sorry, but it goes to progesterone and
So it doesn't. So
hydroxyprogesterone. It doesn't.
it
Oh, it
doesn't.
skips
So
those
it
steps.
skips
Oh,
and it goes
interesting.
down
Okay.
here.
Okay.
So then this is where a lot of times with women's health, progesterone's one of the first things that you notice is off. So like maybe they're not ovulating.
Mm-hmm.
That's a t big one, or like they're struggling with infertility. It's typically because of this.
Okay.
Um, so that is important. And when that happens again, you're getting depleted of nutrients. Okay, so let me skip along. And then what happens is, like I said, cortisol takes priority when we're making hormones always. So that could end up, and this is where someone had asked from the Substack article, well, what about men? You didn't talk about men. I specialize in women's health. That's why I didn't actually mention men, but I do work with
Mm-hmm.
men in like an athletic realm, and I see this
Mm-hmm.
pattern a lot too. So their testosterone will be low based on this same need for cortisol. So it
Mm-hmm.
doesn't mean that none's like ever being made. It's all based on like how the hypothalamus responds to your body's needs. Like there's still some signaling happening, but most of the
Mm-hmm.
signaling is telling the brain, we need more cortisol, like we need more cortisol. So then other sex hormones don't get created as much. Okay, so and then here I sit
Okay.
over here, hormone production depends on nutrients, ATP, oxygen, right? So, okay, yeah. So that's the same in men and women. How do I skip? There. Okay. I'm not going to talk about this yet. Oh wait, where's my? Oh, I gotta go back. Here. So when we're giving someone, typically like an SSRI, SNRI, what it's doing is blocking reuptake of what your body already has available.
Hmm.
So it can help for a little bit, but because you still need those nutrients that I mentioned to make
Hmm.
serotonin, norepinephrine, dopamine, then it may not work. And that's why a lot of times people are like, well, yeah, I was taking it, it worked for a while, and then it stopped working. It's because you
Mm,
ran out of nutrients essentially. And you also
interesting.
didn't pinpoint what is stressing your system so badly to deplete you.
Mm, okay.
Yeah.
Well, now we're talking about this. I think this also relates to what you just discussed. In your essay, you write that your body doesn't know the difference between a real threat and a perceived one. And I think this seems crucial to me in these times because if we have an entire generation of people whose threat perception has been systematically heightened by ideological narratives and political narratives, it seems like we would expect to see exactly what we're seeing, epidemic levels of anxiety and depression. And I'm wondering, wouldn't that suggest that the intervention needs to address the chronic stress response you're just talking about, not just prescribing medication? Medication doesn't seem like it's going to get to the root of what you're talking about.
Absolutely. Yeah, that's exactly it. That's yes.
Hmm.
So I agree with you. And that's where, I'm not saying I'm not a huge fan of using medications because, oh, you said this too. What's the impact of using them? Like it can affect like sexual function and it may just not work. So then you're having this improper signaling that is then worsening other hormone production in a sense. Like so, but yes, to your point, like
Hmm.
sure, if you feel that medication's helping you, at least address nutrition and get these specific nutrients that I'm talking about to help support as like a baseline. And
And what role
yeah,
okay. And what role
sorry.
do you think processed, how do you, okay, nutrition is obviously important to the and the diet of the average American has clearly deteriorated over the past decade or so.
Mhm.
So, given the increasing use, consumption of sugar and processed foods, do those contribute to the symptoms you're talking about and the hormonal dysregulation?
Yeah. So here I'm gonna go to another slide too that I have.
Okay.
I built out a whole thing. Okay, let's
Okay.
see.
Yeah.
Uh, where's this one? Okay, so yeah, so when you're eating a processed sugar, I don't agree that fruit is detrimental. I think we need lots of
Hmm.
nutrients from fruit and especially vitamin C. That's like honestly,
Sure.
that's my number one recommendation. If you have anxiety, start supplementing with vitamin C. It is like the simplest thing you can do because it
Hmm.
helps that cortisol response. And it's so simple. And that's where I said it's like a lot of this is super complex, but I think the solutions are actually, at least baseline solutions are simpler than we are making them, you know?
Very
Um,
cool. Yeah.
yeah. So, okay. So cortisol, it increases your blood glucose levels. The reason it does that is like when I was saying in the beginning, your fight or flight response, that your system is on high alert. So your blood glucose levels go up because it's pushing that glucose into your brain so that you can think better. It's like, okay, how do
Hmm.
I survive here? So if
Hmm.
we're forcing that increased blood glucose just through what we're eating or from like fried foods that can be inflammatory or just like the crap that's totally not doing
Hmm.
anything for you and making you secrete more cortisol, it's causing this to be worse, which then increases your um, like it causes your insulin to not work, so you become insulin resistant. So
Hmm.
insulin's helping you store glucose for later when you need it. But
Hmm.
because if you're like a lot of us do, we're really stressed going to something, maybe we'll grab a coffee and a donut or something. And that is just the worst thing to do because first of all, your body's not going to utilize that glucose that you just ate properly. it's going to be spiking your blood glucose levels. But then because your insulin response goes down, it's not pushing it into your muscles or into your liver as it should to be stored for later. And then eventually you're crashing later once you've run out of that, you know, glucose in your system. Then you need more caffeine, then you need more sugar. So it's doing this all day to your blood sugar. Uh, like, hello, anxiety, you know?
Yeah. I'm listening to this and I'm thinking, this is really powerful because it seems like there's this link between the widespread depression we're seeing, I mean, epic levels of depression, and nutritional deprivation, which is what RFK Jr. has been hammering on ever since he's, stepped into the HHS role, which is, we've got to make America healthy again. And
Mhm.
he's getting a lot of flack for that because, quite honestly, it seems like, there are a lot of Americans who are just happy with the state of being, the state of, their diet. They're happy with the state of, food production on our food systems, and they're not bothering to think like, but does that have any connection to with the way I feel? There's so many people who don't feel well, and they just
Right.
stop noticing it, I think.
Yeah.
It's wild.
I agree with you.
Um,
And that's,
yeah.
and not to sorry to interject, but I
No,
think
no,
it's a good
please, yeah,
point. Like, a lot of times, even when I'm just first meeting with a patient, I said, do you ever pay attention to how you feel after a meal? And they're like,
yeah.
well, yeah, I get tired. I'm like, you shouldn't be tired after a meal. It should give you energy. That's a huge sign that that food inflamed you. Unless it's like turkey
Oh,
that has,
interesting.
yeah. Unless it's turkey with tryptophan, that'll naturally make you sleepy, which is great.
Mhm.
It shouldn't. And I used to say the same thing, well, I'm in food coma. Or, I mean, this was a huge one. To know, I mean, I already knew I had issues with gluten or I was maybe suspecting it, but when I was trying to be gluten free, I thought the McDonald's French fries, which is this was years ago, were gluten free, like on a road
Ah,
trip. And I would get them every time. And every time I'd eat them, I would immediately pass out. And I just didn't connect it at the time. This is way before chiropractic school. And thinking about all this stuff. And I'm like, well, yeah, there was a gluten in that. And also that, like, once again, that glucose carb spike with nothing else to help it. Then I
oh,
would
yeah.
hear, and I'd immediately wake up and I felt hungry again because my system was so depleted. I was looking for more energy. So I think, like, understanding how your body responds to food is super crucial. Be aware of that. It could actually give you some awareness of, oh, maybe that isn't good for me. And then also, if you feel like those cravings you have for sugar, sweets, salty foods, that's another symptom, typically of like someone who's more in that cortisol-driven sympathetic state because
Mm,
of how your body gets depleted of um, like even sodium from stress. So,
mm.
yeah,
All right.
yeah.
Um, okay, so we've covered hormones. Now let's move on to another subject that you covered in your essay, which is the gut-brain axis.
Hmm.
Axis. So, and my understanding is that's the sort of like intricate communication system between the digestive system and the brain.
Hmm.
It's an area where I think there's quite a bit of robust research, but I don't think it comes up in standard mental health treatment a lot. So, can you just take some time and explain what that gut-brain axis connection is and why this well-established science hasn't been translated into sort of widespread clinical practice?
Yeah. I'm actually going to use a different example, or is it the, I don't think, is that the
Okay.
example I used? A different case example. It's really similar. Maybe it's the same one. I'm not remembering right now. Anyways, but
Okay.
it's a good example of you're like, oh, people ignoring that science when there's so much science about
Mhm.
it. Um, like a very
Hmm.
well-known neuro neurologist helping a patient for migraines, and she's also like losing her mind and super depleted, and she's irritable, like super on edge, anxious, you would call her, or even she was saying bipolar, and they
Hmm.
were flirting with that idea that she was bipolar. And so then she met with me and I was telling her about leaky gut. So leaky gut is when it's
And
gut permeability.
what is leaky
Yeah.
gut?
Yeah. So it's
I'm
gut
sorry. You might want to, okay.
permeability. Yeah. So it
Okay,
just
fine.
means that you your intestines are inflamed and they have become a little bit damaged. And so
Oh,
so when we eat food, um, where we chew it up, it gets the saliva breaks it down, more breaks down the stomach, goes through other areas into the intestines. But if there's inflammation in the stomach, then there's these gap junctions that start to open within the
mm,
gut lining, and then you can have like toxins spill out, and then you see people have things like eczema or other sort of like skin
oh,
reactions, acne a lot of times. When someone has that gut permeability. So that's that leaky gut. Um, this
mhm,
neurologist said that that is completely false and that doesn't even exist. Leaky gut is a made-up term. And I'm like, wait, what? There's
mhm,
so many research studies on it now. So that I was telling her how that's attributing to her migraines and her mood. And that happens because there is something called the vagus nerve that is a cranial nerve, and it goes from your cranium, this is your cranium, and
mhm.
exits, goes down, controls quite a few organs and into the gut. And so signals are transferred between the gut and the brain. It goes both ways.
Mhm. Mhm.
So that's where sometimes, like, if you get really nervous before something, then you get an upset stomach. Like a lot of kids struggle with that.
Oh
And
yeah, yeah, might just say, yeah, yeah,
yeah, so
yeah.
that's that communication between that vagus nerve and vice versa. So if there's inflammation, bacteria, viral, whatever, the person's maybe not eating enough fiber, they're not, they don't have a lot of short chain fatty acids that's good for gut health, then that vagus nerve sends a signal to the brain, and that can affect your mood and cause like neuroinflammation, essentially.
Okay.
Yeah.
Well, how long, in your experience, how long does it typically take to see mental health improvements when someone addresses gut dysfunction? And I ask this because well, it seems relevant to the question of treatment timelines. If give you an example, if someone can feel significantly better in weeks or months just by healing their gut, why then are doctors so quick to put these same people on psychiatric medications that may take years or even a lifetime to address the underlying their symptoms or the underlying
Right.
cause rather?
I don't know. I wish I knew. This is where I get confused, and I think it's what we talked about in the beginning. I I think there's a lot of initiative that you have to take in order to learn all this additional stuff. That's
Hmm.
that's really weird. I don't know. And I think
Are doctors lazy?
I
Or
don't
is what
think
you-
doctors are lazy. I don't know. I think, if you have a
they don't
full
have time.
Yeah, if you have a full patient schedule,
Yeah.
short visits, that doesn't allow enough time to educate a patient. I tend to work with
Mhm.
patients a little bit. I like work, at least my follow-ups are 30 typically, unless it's like a quick adjustment. Um, yeah, I don't know. I wish I knew why. I think it's just the time constraints and maybe like lack of getting paid for spending the extra time. I don't know.
Oh, that could be.
Yeah,
Right,
I
right,
don't
right.
know.
That makes sense.
Yeah,
Especially as medicine has become increasingly corporatized and, they only have a certain amount of time to spend with each patient.
yeah.
That would make sense. Let's move on to something else that might affect mood, and certainly health. And again, in your essay mentioned toxin exposure
Hmm.
um, and nutrient deficiencies and chronic stress, but there's often, I think, institutional resistance to investigating environmental causes of illnesses. And by that, I mean pesticides, industrial chemicals, or even the effects of hormonal birth control on, young women's mental health. Have you found that certain topics are off limits in mainstream medical discourse when it comes to the effects of toxins on our health?
Mm.
I'm sure you've read the stories about glyphosate and I think I forgot the other. There was another chemical that was discovered in the food supply recently. But one of the first questions was when, there was a question about safety, and the response was, well, it's FDA approved, so it must be fine. But I'm just wondering, do you think, have you had trouble discussing with your colleagues, with your peers, the connection between environmental exposure to toxins and the way that makes us feel physically and more importantly, mentally?
Yeah. Not with, well, even some chiropractic practitioners, yes, a little bit, but it's more of that like stay in your lane thing.
Hmm.
And why am I even talking about that? But like even I I'll share what contraceptives will do for women's health. And I definitely get some backlash from some OB-GYNs on that.
Okay.
Yeah, yeah, gynecologists for that.
Yes.
So, um, and it's like, well, there's different types of hormone birth controls. I'm like, yes, there are, but they still stress the system and cause abnormal, like, I mean, they're supposed to suppress ovulation, right? Majority of them.
Hmm. Hmm.
But even still, even if it doesn't, there some of them that don't fully suppress ovulation still can cause more anxiety just from having the synthetic hormone in your system. So, um, yeah, like
Okay.
but yes, I do think it's difficult sometimes to talk about that, but I think it's starting to be more discussed.
You
Uh,
do?
yeah, gosh, what is she? She's an MD. There's a book that I love on this if anyone wanted to like really deep dive into this.
Okay.
It's called The Fifth Vital Sign.
The fifth vital
What's her
sign.
name?
Okay.
Lisa,
Make a note of that.
yeah, Lisa Hendrickson Jack, I want to
Okay.
say. What is she?
Hmm.
Um, she might be an MD.
You can look it up.
Yeah. Anyways, that's a good one. And I mean, she's gone through like lots of research on how contraceptives deplete you of
Lisa
certain
Henderson.
nutrients
Hmm.
again. And if we're talking about that, and that can push you into a more stressed state, being nutritionally depleted, like that's basically what happened to me. And it happens to a lot of women, is it basically exacerbated my adrenal issues and adrenal fatigue with that. Which, yeah, I was
Hmm.
like, I'm happy to go into more in depth with that now if you wanted, or I can wait for the
Please, yeah,
next
just go. Yeah, before we move
session.
on, maybe just touch on that a little deeper.
Okay, then I was like, then I'm going to go to my slide I made for it. Okay, so, and let me go back here. Yeah, yeah, yeah. Great. So, obviously, like as we know, hormone or the birth control is supposed to suppress ovulation. Okay, so the combo pills are the ones that I would say have the biggest impact on the nutrient depletion.
Hmm.
So B6, like I've listed all here, B6, B12, folate, that also affects serotonin and dopamine synthesis, where like
Hmm.
these mood issues stem from. Depletes you of
Hmm.
magnesium, depletes you of zinc, depletes you of vitamin C.
Wow.
And then this is where like the argument, or not argument, I think it was supposed to be a discussion with some
Wow.
of the people who message me when I'm talking about this stuff, where the progestin only methods happen. And it still depletes you of these nutrients that affect your mood
Hmm.
and neurotransmitter synthesis.
Hmm.
Uh, and I mean, I think you guys have now heard about Depo-Provera.
Yeah,
The
we have. Yeah.
Yeah, so and that's one that I've seen when I see patients now, like consulting for Center for Integrative Health and
Hmm.
their mental health struggles. That one was a huge one for causing like extreme panic anxiety because
Oh.
of the synthetic progestin. Also because it's a concentrated one-time shot versus a slow rollout
Time
of the
release.
synthetic
Yeah, yeah,
hormones. Yeah,
yeah.
yeah. So, and
Oh.
I don't know. Let me see. What else did I do here? Mm.
Yeah,
Yeah.
I don't think many people are even aware that contraceptives can affect their nutritional levels. It's the last thing I would have expected.
Yeah. Well, that's why I mean this so I'm basically laying it out here in very summarized
Sure.
form, but that book that I mentioned does that in like very in-depth detail.
The fifth
With
vital sign.
yeah.
Okay.
Yeah. But I just wanted to summarize here so if someone didn't want to read all that.
Yeah. Thank
Yeah.
you.
Yeah, of course.
Um, I would say so at FAIR, we've observed what appears to be a social contagion around mental illness diagnoses, particularly for young people, but really for everyone at this point. And I'm just curious, from your physiological perspective, is it possible that what we're seeing as a social contagion, whether it's, affecting gender medicine or just people who are just consumed by the latest political ideologies and just really worked up about them, might we be actually looking at clusters of people with similar environmental exposures and dietary patterns or lifestyle factors? And this may be going out on a limb, but it just seems to me that we've seen this ramp up of mental instability in our country at the same time that our nutritional fitness is sort of, you know, tipped over the edge. It's becoming less robust.
Mhm.
So I'm wondering how much of this epidemic we are seeing of mental illness might be genuinely physiologic, like clustered, like certain people exposed to certain things. I don't know if that makes sense, but I'm wondering if there just has to be some convergence, it seems to me, of factors that's fueling all of this. Maybe it's nutritional, maybe it's environmental, but there's definitely something that's happened in the last decade or so. Do you have a big picture perspective on that, or have you noticed it as
Um,
well?
yeah, I don't know. I mean, it's like there's always going to be something that's stressing you out, right? So I think a lot of people are
Mhm.
like, well, why are we even talking about this? So basically, if I'm always going to be mentally stressed because I'm unhappy with the political climate um or unhappy with whatever, then it's like, well, this is like to me, this isn't I think people are like, well, then who cares? Like I'm all like, of course there's going to be more illness based on the state of our country. I don't know if this is like where you're going with this, but
Yes, yeah, pretty
yeah,
much,
and
yeah.
it's like, yeah, I agree. But why don't we support ourselves because we have this education and knowledge? And in my mind, like if someone goes into the office, this could be as simple as like a nutrition handout given to every person, like even an MD's office or wherever someone's seeking help with mental health. And just like
Hmm.
a little educational sheet on like literally what I'm just saying now, like how sympathetic dominance can deplete you. So maybe eating more of these foods in your diet and these nutrients will be super beneficial and help you. Also understanding that, um, I mean, now I'm getting like a little more spiritual route, but uh,
No, okay.
like, like we can't allow external factors to completely take us out.
Hmm.
And that's where like a lot of my practice has gone to. It went from seeing how so structural issues and then how hormonal and metabolic issues affect structure. And then of course, like with the hormone imbalances and helping women, especially like with infertility and nervous system regulation. Then of course emotions come into it too, right? So then we've kind of
Sure.
gone down that path. Um, like something I've hammered home a lot. It's like, well, we can't allow this to deplete us in this way. So coming up with some sort of practice that doesn't allow it to control you.
Hmm.
But if you're nutritionally depleted and you're eating those sugary foods that you're talking about, or you're having this stimulating caffeine where you're up and down, makes
Hmm.
it a heck of a lot harder to come to that understanding and look at something from a different perspective. Um, do you know what I'm saying?
Yeah,
Like,
yeah, no, totally.
because of how stress or of how that is stressing our brain and our reactions to things. Um,
It becomes
and
a
it
loop.
goes
Yeah.
both ways, even like just the mental stress, like, you know, inhibits your reasoning and makes you more reactive. So does the food. And that was the whole point of this discussion, right? And like
Sure, of
hormone
course.
health. So I think just knowing that, there's still ways you can support yourself, but um, like also empowering people to take control of your health and then as practitioners, hey, we're here to help you with that too. Like we hear you.
Sure.
Like I know you're upset and I'm not invalidating you being upset, but like so here, let's do some like cranial sacral work to stimulate parasympathetics. Let's talk about
Hmm.
meditation. Let's talk about breath work. Let's talk about food and nourishment. And then if we need
Holistic.
additional supports, yeah, holistic.
Holistic. There you go.
Yes. But I will say this, and
Okay.
sorry, because you said you noticed a trend, and I just think it's so important to mention, and I could maybe hammer it home more in like the
Mhm.
next one, but it's just something to mention. Okay, let's say you're someone who has a grip on not allowing external factors to completely derail you. Um, you also eat pretty well. Like you feel like you're, doing this all right, but there's something still draining you. So to your
Mhm.
point, the toxin talk is important. Like, is there mold involved? Are you, I mean, the plastics are important, all that stuff, like, the
Mhm.
endocrine disruptors. If you switch out a lot of your care products, that is very helpful. Um, but honestly, the most common thing I see is the viral load.
The
So
viral load.
yeah, in people.
Oh.
So whether it's like chronic infection, and so if you constantly have something signaling to your brain, we're under stress, right? I said everything is feedback to the
Interesting.
brain, then that can deplete the person. And even if they're pretty chill, like they have a pretty even keel,
Mhm.
but this is what I'm seeing a lot with women's health. And can I touch on that for a second too, and just show
Well,
the
yeah,
hormone
it
chart?
makes me think of
Okay.
these chronic COVID
Oh,
infections
good,
that
right
we've
here.
gotten for over the past several years. People were consistently getting COVID again and again and again, and
Right.
that's
And
a,
I
carrying a heavy viral load.
Correct. And that's why you said, well, what's changed? And that's why I wanted to add that too. Like
Okay.
um, so like looking at this chart, you can ignore the
Okay.
birth control cycle. We don't need to go into that. But
Mhm.
like basically, I don't know if people know the first half. So most women's, this is for a menstruating female, by the way.
Mhm.
So
Sure,
women
got
that
it.
can get pregnant. So we have these hormone fluctuations throughout the month because like the LH and the FSH go up before we ovulate. Progesterone happens if we had a successful ovulation,
Hmm.
um, and healthy estrogen production. But we have these natural dips. So you see like here, wait, my cursor. So like this
Yeah,
natural dip right here. So this would
right.
happen basically right after ovulation.
Hmm.
And then this happens right before you bleed. So with the drops in estrogen, your immune system becomes a little bit more dysregulated. And so this is where
Hmm.
you'll see a lot of women's symptoms within the luteal phase of their cycle because of that immune dysregulation. So if they have a viral load, then their anxiety, their depression, their manic episode, whatever it is, a lot of times is tied in with this.
Oh,
Yeah,
wow. Well, will we have access? Would you mind sharing these slides
not at
with
all. Yeah,
Oh, that would be wonderful.
not at
I'd
all. Yeah,
I'd love to refer to these. Oh, and
yeah,
before we move, I want to close out on a question with empowering patients. But
yeah.
yeah, I'd like to get to one of the questions we had, which is what type of magnesium is best to replenish the system? There are many forms of magnesium, and they seem to affect different areas. Can you give us some clarity on that?
Yeah, I usually, if you, I like what am I trying to say? The magnesium complex where you're getting all of them. I don't think that's bad to do because of
Mhm.
how they affect different things.
Mhm.
I usually just say, try that, and you're not really going to overdo it because of how much our system needs for magnesium.
A
Um,
complex. Okay.
yes, a complex. Yeah. Kind of like a B
Okay.
complex where you're getting the wide range. And I agree
Ah,
with
like
that
a B
too.
complex.
Yeah.
Okay, that makes sense. Okay, so we're at the top of the hour or the end of the hour, but I just wanted to ask one final question. So, one thing I really appreciate about your approach, Dr. Kautz, is the emphasis on empowerment, which you were just talking about, helping people understand more about their bodies so they can make informed decisions. And that's what we emphasize repeatedly at FAIR. We have these discussions so we can make informed decisions about our health, whether it's about whether to transition from a male to allow our children to transition from male to female or vice versa,
Yeah.
or if it's just these simple issues of, hormone dysregulation that might affect our mood. So we really focus on informed consent and individual autonomy. But it seems to me that in order to challenge a medical model that often positions patients as passive recipients of expert intervention, just we sit here and what do you think we should do, doctor? What should I do? Just tell me what to do. And that's not always the answer based on, I mean, we've learned just so much in an hour about how our bodies work. So my question is, how do you cultivate this sense of agency in your patients, especially when they come to you after being told their only option is medication? And this, as a follow-up, what foods would you recommend? You mentioned vitamin C, which is a new one to me. I did not know vitamin C was so powerful. I'm going to stock up on the oranges. But what foods would you recommend for better mental health and to
Yeah.
reduce anxiety in these very, challenging times?
Okay. I should have stopped. I should have kept sharing my screen. Let me just
Oh,
re-share it again
okay. All
because I
right.
put that on a slide so people can take a photo. Hold on.
Yes.
Sorry. Um, oh, how do I? Okay. Where do click to exit full screen? Oh, here. And
Oh,
then
okay.
hold on. And then I put it. So, I mean, you're talking about, okay, so the food piece,
The
like,
food piece, yeah.
so
Oh,
yeah.
okay.
So if people, I mean, these are just some, right? You can just Google like what
Hmm.
has these in it. So making sure you're getting magnesium, B vitamins, the vitamin C. And that's so, especially when I'm working, well, honestly, with anyone who I'm sensing this stress from, I say
Hmm.
never skip out on your fruits and vegetables, which is once again such basic advice, right? But I think people have gotten very comfortable with eating adequate protein now. I think we've hammered that home really good. Like that messaging is
Absolutely, for
there.
sure.
Yeah,
Yeah.
so I love it. But then people forget to eat fruits and vegetables. So
And
that's,
chocolate, we get to eat chocolate too. That'll make us
yeah, well,
happy.
you don't want to do too
No.
much because that also can have a stimulating effect. But yes, there's
Okay.
magnesium in chocolate. And that's
Okay.
like an easy, nice, like little treat if you're wanting that. I'll give this little tip too. It's not on, this fruit isn't on here.
Okay.
But when people are really struggling with blood sugar spikes and they constantly are craving sugar, um, dates can be super helpful because of how
Mm,
sweet they are and it'll satisfy that craving. So if you are someone who's wanting to limit like your processed sugar consumption, but you're just like,
mhm,
I need it. It's actually okay. Like the fruit will be very supportive of your
mhm,
hormones. So dates are fine and you're not gonna like overdo it, but you want a variety of things. But I that's usually my like number one thing to kind of cut that sweet craving.
mhm.
So yeah, so vitamin C, omega-3s, protein, obviously, and then the calcium, potassium, sodium, zinc, iron, selenium. That's
Okay.
well, I just think it's important to just have those in your mind. Like when I worked
Hmm.
with athletes at UC Irvine in their program, I just had a whole pamphlet of information and I listed all the food sources in that. But this was
Hmm.
just for the a condensed version for this today.
And buy organic when possible. I
Yeah.
understand.
Yeah, for
Okay.
the climate state. Yes,
Well,
when possible, not
when
everyone can afford
possible.
that, but um yeah, it's important and can make a big difference.
Very
Uh
good.
yeah. But and then I want to just add on one thing you said the empowerment
Okay.
piece. When people are in the doctor's office, I think
Hmm.
and when they come see me, I this is where I typically spend a lot of my new patient visit educating, especially with women's health, on even that
Mm.
cycle, that hormone thing. So I typically spend a good 15 20 minutes explaining what I just found in my
Hmm.
findings, which I don't always think happens in a doctor's office because it is so fast. So that's so if you're I think if you're not getting that from your practitioner, if you can afford to go somewhere else, do that, someone that's willing to spend that time with you, but educating yourself on that, especially for like women in that the cycle phase, what's happening in that? Uh, and then track your symptoms so that you have more awareness of where you're at in this phase of your cycle and then how you can support yourself with that. And knowing that you're not having like a catastrophic event, your estrogen probably just dipped for a little bit because that's your pattern, and that happens
Ah,
at the time of your cycle.
very good.
Yeah.
Okay, well, we went a little over, so thank you for your patience and your time. This has been incredibly valuable, Dr. Couts. I think you've given our audience not just some very practical information, but it's a framework for looking at these issues and thinking critically about how to approach mental health and mood, both just individually and as a society, for that matter. Your central message, I think, that the mental health symptoms often have physical roots, that investigating these roots requires scientific rigor rather than just assumptions, and that understanding these connections can really be empowering. All of that aligns perfectly with our mission of informed consent. Um, and also, again, just to reiterate, we're committed to defending scientific integrity and supporting viewpoint diversity in medical research and practice, and advocating for treatments based on evidence rather than ideology or financial interest.
Mhm.
Um, so before we close, Dr. Couts, how can people learn more about your work or connect with you if they're interested in finding practitioners who take this comprehensive, holistic, evidence-based approach to health?
Yeah. Well, to connect with me, um, I mean, I'm on Instagram and the handle is at aligned with Dr. Kendra. I also have a website. It's doctor spelled out kendra.com.
Mhm.
Um, and then I think if someone's looking for someone in their area, I do think functional medicine or functional nutrition practitioners are really helpful. Maybe
Mhm.
now looking into applied kinesiology practitioners, like chiropractors too.
Mhm.
I don't think all of them maybe focus on the functional nutrition side.
Mhm.
Not everyone does, but at least they're aware of these connections. So I think it's nice to work with someone who's aware and can um, piece everything together and treat you in a more holistic way.
All right. Good advice. Good advice. All right. Well, thank you to everyone for joining us tonight. I'm sure you know that the work of restoring scientific rigor and intellectual honesty to medicine, asking the hard core questions about why certain approaches are elevated while others are suppressed, this is all crucial work, and it starts with conversations like the one we just had this evening. So we hope you'll leave tonight with new frameworks for understanding the intricate connections between body and mind, new questions to ask of your health providers, and a renewed commitment to seeking truth even when it challenges established narratives. And I also want to remind everyone that FAIR exists entirely on goodwill. We're able to operate solely based on donations from curious and interested people like all of you attending tonight. We do our very best to offer content that helps to educate, bring awareness and attention, and solutions to what we feel are the most timely and relevant issues facing us today. We hope you'll consider donating to FAIR and to help us keep doing the work and bringing you the content that you value. The link is in the chat, or you can visit us at fairforall.org to make your contribution. And lastly, be sure to join us next month for a follow-up discussion with Dr. Counts, when we'll explore how these same physiological factors have a unique an impact on adolescents. And it's a conversation that's especially urgent now, given how quickly we're medicating young people without investigating root causes, and they are turning to options like gender-affirming care. So be sure to check our newsletter for more details in the coming weeks. So from all of us at FAIR, thank you for being here for this conversation, and thank you for your support as always. Have a wonderful evening, everyone. And thank you, Dr. Couts.
Yeah, of course. Thanks for having me.
Bye-bye.